are you? I'm Ashley and I'm going to be your nurse today. Today we're doing a urinary catheter. Your doctor ordered it, so we're just going to go ahead and check your name and date of birth. Alright, thank you. I'm going to wash my hands and go ahead and put on gloves. I already made sure that the curtain's closed and we're in a safe environment for this. So before I even touch you with my gloves, I need to know if you're allergic to latex, iodine, betadine. Okay, sounds good. I'm going to go ahead and pull this back. I just have clean gloves right now because we're going to do a just perineal care. And while I'm doing this, I need to know if you understand the procedure. It's just going to be a little uncomfortable, but if you are ever too uncomfortable, just let me know and we'll stop and just take deep breaths and relax, and it will be over before you know it. I'm going to go ahead and raise the bed to a working height, and I'm going to make sure the patient's in supine position with their legs apart for a male. So looks like everything is good. So I'm going to go ahead and take off my gloves, and I'm going to wash my hands again. I'll go ahead and set up for the procedure. Now putting a catheter in is a sterile procedure. I have to make sure that everything is sterile. I'm going to go ahead and set up my trash bag. Shove it in here. Okay. Now I'm going to pull this one away from me first, the sides, and this one. Alright, since this is all sterile, I need to go ahead and put my gloves on over here, and I do not need to turn my back to the patient ever. One second, I'm sorry. Okay, go ahead and slip this one on. Go ahead and set this up so I have a sterile working field. So we have a 1-inch sterile field around everything too, so just make sure we don't ever want to contaminate in any of this. So let me go ahead and set this to the side. Get everything set up. Okay, I'm going to go ahead and take my specimen container because we're going to have to get a specimen after we insert the catheter. Now I'm going to go ahead and open the betadine, and I'm going to pour it all on the cotton balls. Now I'm going to go ahead and dump that. Before I start, I'm going to go ahead and take these caps off. Go ahead and set the catheter out so it's ready to go after I do perineal care. Okay, let's go ahead and wash in a circular motion from the meatus to the pubic area. I'm going to do the same circular motion again. Wash down the shaft. Wash down the shaft. And then I'm going to clean the meatus one more time. Okay, now I'm going to dispose of these in the bin. Okay, I'm going to go ahead and hook the water up to here, and the water has 10 milliliters. So whenever I empty it later, I need to make sure I have the same amount of water. Okay, we're going to start with grabbing the penis with my non-dominant hand, and now I cannot contaminate with that hand again. And then insert all of the lube into the penis. And just let me know if it's uncomfortable. Just take deep breaths, please. Now I'm gonna drop that. Okay. Grab the catheter. For a male, I'm gonna insert the catheter all the way up. I'm going to keep going, so make sure it's all in the bladder. Okay, now I'm going to hold the tip of it. And go ahead and insert the water. You doing okay? Almost done. I'm going to remove the water. I'm going to throw this in the sharps container. I'm just going to tug on it to make sure it's securely in there. It looks like it is, so I'm just going to move this, and we're going to tape this up on the abdomen. Okay. Now the sterile part is done. I'm going to go ahead and take these gloves off. I'm going to make sure this glove is inside of the other to make sure we do not contaminate. I'm going to throw that in there. Now I'm going to move the bag and hook it on the hook down here, and it will always be below the patient's bladder. So, hooking it, and it's going to drain into the bag. For the sterile specimen, I'm going to wash my hands and grab the sterile cup, and I have gloves on for this. I'm going to unhook this. I'm going to let it flow into it by unclamping this, and after it's done, I'm going to clamp it back, hook it back. I'm going to screw the top on. I'm going to label it, and I'm going to send it off to the lab. So, everything's good. Are you feeling okay? Are you in any discomfort? I'm going to make sure that the call lights by the patient, the arm rails are up on both sides, that they're not in any discomfort, and just let them know that they need anything, they can just call us. So, I will be back later to check on you. So, alright, the doctor has ordered to take out the catheter, so I'm going to confirm the name and date of birth again. Okay, and you told me earlier you did not have any allergies, so we're going to go ahead and I'm going to put on clean gloves. And I'm going to go grab a new and take out the water. Go ahead and start taking the water out. I know the amount I had earlier, so I'm just going to ensure that I get that amount again.
Do you have any allergies to betadine, latex, or iodine? No? Well, the doctor has ordered for you to have a catheter inside.
I'm going to dispose of this in the sharps container. Just until you take some deep breaths and pull it out. Alright, thank you. I'm going to go ahead and grab the bag and so make sure one more time that the patient is not in any discomfort. And okay, sounds good. You have a good day.